Welcome to Channel 17's Health Roundup series with St. Anthony Granby Medical Center. Today I'm here with Karen Charland, nurse practitioner here at Granby Medical Center, and we're going to be talking about high altitude sickness and staying hydrated in the higher elevations. So Karen, I've heard a lot about high altitude sickness and the importance of keeping hydrated. What are some of the causes of high altitude sickness?
Well, that's a great question, Jody. So here in Grand County, we're at 8,500 feet. A lot of people that come up here to visit are not used to living at this type of altitude. There's a lot less oxygen up here. So some people come up here and do fine, and some people develop acute mountain sickness. There are actually three different types of altitude sickness. The first is acute mountain sickness, which is the most common. The second type is called high altitude pulmonary edema, and that affects the lungs. And the third type is high altitude cerebral edema, and that affects the brain.
Wow. So what are some of the symptoms of high altitude sickness? How do you actually know, is it just a common headache that I'm experiencing right now? Maybe I don't feel good. What are the symptoms of high altitude sickness?
The most common symptoms that we see, actually, headache is very, very common. People sometimes get sick to their stomach. They can be lightheaded, and they have difficulty sleeping, and they're very fatigued. And it's not a typical headache. It definitely feels worse than that. If people develop the high altitude pulmonary edema when they have fluid in their lungs, they're going to have trouble sleeping, they're going to be coughing, they're going to be very short of breath. And if they develop the most severe type when they have fluid in their brain, they may be confused, they may even become unconscious. And obviously, any of these symptoms, you'd want to seek medical care immediately.
And lastly, how do you prevent high altitude sickness? Are there things that you can do before you come on vacation or even while you're here to prevent that sickness?
Yes, there are a lot of things you can do to prevent that. The first thing is, if you have an extra day or so, spend it in Denver, where the altitude is probably between sea level and up here in Grand County. That really helps. Then when you come up to Grand County, you probably should just have a day of rest and not start physical activity right away. And the key is to drink a lot of water. Colorado is a very, very low humid state, so drinking a lot of water and staying hydrated is extremely important. You want to avoid things like caffeine and alcohol because they actually dehydrate you and make things worse. And if you're a smoker, you definitely don't want to smoke the first couple days up here because you're going to have trouble breathing.
Well, that's great information. Thank you for sharing with us.
You're welcome.
And thanks for watching St. Anthony Granby Medical Center's Health Roundup series on Channel 17. I'm Jody Mintkin, and stay tuned for more.